Hello. This recording is for people who have type 2 diabetes and use insulin twice a day. The purpose of this recording is to enable you to know how to adjust the dose of your insulin. It's very important that people who have diabetes feel confident in how to look after their own health, and that's just as important for your insulin as for other things like your diet and your exercise. One of the benefits of insulin is that it's very adjustable, and so everyone with insulin is able to find exactly the right dose to suit them personally. The adjustability of insulin also means that you can change the dose according to any changes in your life. So, for example, at periods when you're eating more or eating less, you can adjust your insulin yourself. At times when you're getting more physical activity or less, you can also adjust the insulin. And lastly, when you're sick, particularly if you have an infection, you'll also need to adjust the dose of your insulin. And the purpose of this recording is to explain to you the principles of how you can adjust it yourself. This recording on its own probably won't be enough for you though, so do make sure to discuss this with your nurse or your doctor, and if you ever have any questions about your insulin dose, don't hesitate to get in touch with them. We're going to talk about 4 situations in which you can adjust the dose of your insulin. The first is simply to achieve good control of your sugars on a normal day-to-day basis. The second is if you have a change in the amount or the type of food that you're eating. The third is if you have a change in the level of physical activity that you take. And the fourth is if you're unwell. We're going to talk about 4 situations in which you can adjust the dose of your insulin. The first is simply to achieve good control of your sugars on a normal day-to-day basis. The second is if you have a change in the amount or the type of food that you're eating. The third is if you have a change in the level of physical activity that you take. And the fourth is if you're unwell. So here's number 1. Adjusting your insulin for good day-to-day control. When you first start insulin, we always start it at a very small dose. There are 2 benefits to this. The first is that you're much less likely to have any problems with hypos, where your sugar goes too low. And the second is it gives you an opportunity over the first few weeks, together with your nurse and your doctor, to work out what the best dose is for you to give you good control during an average week. And here's the principles that we apply. It's always good to check with your nurse or your doctor in the early stages that you're doing this correctly, but it's helpful also to know the principles so that you can gradually take over yourself and make your own decisions about the dose. The principles are like this. We're looking to get your sugar between 4 and 7 on an empty stomach. So that's when you test your finger prick blood sugar test before a meal. We're looking for it normally to be between 4 and 7. It's perfectly okay if occasionally it's higher than 7, but we don't want it to be lower than 4, because that might give you a hypo. Most people, when they start insulin, actually have sugars that are very badly controlled. Perhaps they're greater than 10, maybe even higher than that, and that's probably the situation that you'll be in as you start insulin. So what about the dose of insulin? Well, if you're having insulin twice a day, we're always going to start with a small dose in the morning and a small dose in the evening, and your nurse or your doctor will tell you exactly what dose for you. I'm going to use an example for a patient who starts their insulin at 6 units in the morning and 6 units in the evening. Your exact dose might be different than that when you start. That's okay, you're just going to learn the general principles in this recording so that you can apply it to your own situation. So for this person, we're going to say that my usual sugar on an empty stomach before a meal is 12. It varies a little bit, but usually it's roughly 12. My nurse has recommended that I start insulin at 6 units every morning and 6 units every evening. And I try that for the first few days. And after 4 or 5 days, I see that my sugar has improved a bit. It was usually 12 before, and now it's come down to 10. So the insulin is working. But it's not working enough. Remember that we're going for a goal of between 4 and 7 with the sugar. So I'm at 10 now, that's an improvement, but not enough. So I can now decide to increase the dose of my insulin. And to begin with, I'm going to make quite small changes. And we usually recommend that you make a change of 2 units up or 2 units down with the insulin to get that good day-to-day control. Occasionally, if your sugar goes much higher very quickly, you can make a bigger change in the insulin, perhaps changing it by 4. But to begin with, we're going to be cautious. It's early days yet, and we're just going to have 2. So I'm going to have now 8 units of insulin in the morning and 8 units in the evening. And for the next 4 or 5 days, I'm going to check my sugars and see how they're doing. Well, it's made another big improvement. My sugar now is quite good in the morning. It's about 6 or 7. In the evening, it's improved as well, but it's a bit higher. It's 8 or 9. So what have we found out? Well, the first thing is that as we've increased the dose of insulin, the sugar has come down. I'm now having 8 units of insulin morning and evening, and my sugars are good in the morning, but not so good in the evening. They're not quite right yet. That's actually a very common pattern to find, that the morning sugar isn't quite so bad, it's easier to look after. The evening sugar is higher. And the big reason for that is that as you eat during the day, the sugar goes up. And what that's showing is that the insulin I'm having during the day isn't quite enough, because by the end of the day, the sugar is still quite high, 8 or 9. So what I'm going to do now is I'm going to increase my daytime insulin. So the breakfast dose, I'm going to increase from 8 units to 10 units, because I need better control during the day. But my tea time dose, I'm going to leave the same. So I'm going to have 10 units in the morning and 8 units in the evening. What you'll see with your insulin is that it's long acting. So when you have an injection of the insulin, it works in the body for roughly 12 hours. So your breakfast dose of insulin looks after the sugar during the day, right through to your evening meal. And your evening dose of insulin looks after the sugar through the night. And so, in my situation, my evening sugar was too high. So what I needed to do was increase the morning dose of insulin, because that morning dose of insulin is working during the day right up until the evening meal. So now here I am, I've made my third adjustment, and I've gone so that I'm now having insulin 10 units in the morning and 8 units in the evening. And now, in this example, my sugar's well controlled. It's usually about 6 before breakfast and about 5 or 6 before tea. And that shows that I've made these small changes in insulin dose, gradually going up, and I haven't had any problems. And also, it's controlled my sugar very nicely. Well, what about if I hadn't found it so easy? It's possible that when you make an increase in the dose of your insulin, that actually you get hypos. And you need to speak to your nurse or your doctor about hypos, and they'll be able to give you information about how to recognise that you're having one and what to do if you do have one. But here I'm going to talk about what happens when you've adjusted your insulin dose, you've increased it upwards, and you have a hypo. What should you do with your insulin? Well, the first thing is to ask yourself whether there's some other reason that you had the hypo. Very often people have hypos not so much because they've changed the dose of the insulin, but because they've had less food to eat, or they've had a longer gap between meals, or perhaps they've had a big increase in their physical activity on that day. If that's the case, then you may not want to change your insulin. You may want to keep it the same, But just remember that you do need to eat regularly when you're taking insulin treatment, and it's a good idea not to have longer gaps between meals. If that's going to be an occurrence for you that happens on a regular basis, then we'd recommend making sure that you have something sugary or a starchy snack with you, just in case it's time for a meal and you're not able to have one. So normally, as you're making these small increases in the insulin dose, you won't have problems. Most people with your type of diabetes don't. But if you find that you've made an increase in your insulin dose and you've had a hypo, and you can't find any other reason why that should have happened, you might want to go back to the previous dose of the insulin. In other words, not to have that increase. If you're unsure about it, don't hesitate, just get in touch with your nurse or your doctor and ask their advice as well. Check it out with them. So to summarise, when you start insulin, we always begin at a very low dose. And what we recommend you do is make small increases of just 2 units each time until gradually your sugar starts coming down. If you need to make bigger changes, you can make an increase of 4 units, and that'll have a bigger effect on the sugar. What we're aiming for is that your sugar before a meal should be between 4 and 7, and that you don't have any hypos. Most people need a little bit more insulin in the morning, because that's the one that looks after them during the day, and slightly less in the evening, because overnight you won't be eating. But if you're ever unsure about making adjustments to the dose of the insulin, just speak to your nurse or doctor. But you'll probably find it's generally quite straightforward. Most people who start on insulin don't have any problems getting really good day-to-day control just by making these simple increases and modifications to the insulin dose. It's important to bear in mind that diabetes is a condition that gets worse as time goes by. So you're guaranteed to find that as the years go on, you're actually going to need to slowly increase your dose of insulin. So in the example we've just seen, if in the few weeks after you first start insulin, 20 units a day works well for you, then in a few years' time, 20 units probably won't be enough. And that's because the pancreas gland in the body slows down as your diabetes progresses. And so you'll need more of the insulin injections. So don't think that just because once upon a time a certain amount of insulin was enough to control your sugar, it's always going to be the case. You will need, over the years, just to continue keeping an eye on what your sugars are doing, and bear in mind that step by step, you will need gradually to increase the strength of the insulin you have. There's no problem about that, it's just something to bear in mind for the future. We're now moving on to section 2, where we're going to talk about changes in your food and how that affects your insulin. You'll notice as you begin to test your sugar each day and make changes to the dose of your insulin that the things you eat and the amount that you eat can have a big effect on the sugar. Generally speaking, we recommend that people with diabetes eat regularly, that you have your meals at roughly the same times each day, and that you eat fairly similar things from day to day. The reason for this is it helps to give some predictability and some stability to your sugars. If, for example, you ate very different things from one day to the next, you had very different portion sizes, or one day you had foods with a lot of sugar and the next day you had foods with not much sugar, then you'd find it would be very difficult to decide how much insulin to have from one day to the next. And this is especially true for people who have insulin only a few times a day. So in your case, just once a day. If there were big changes from day to day in your diet, it's very hard to decide what to do with the dose of your insulin. And so we recommend that wherever possible, you eat at roughly the same times each day, and you eat roughly the same kind of food at each mealtime. So breakfast is always fairly similar, and the same for lunch and tea, from one day to the next, without too much changing about with the diet. Obviously, there are bound to be times when you have bigger meals, or you have a celebration and you perhaps have things with a lot more sweet in them. That's okay. Just keep an eye out for the next day or two about how your sugar is doing. You might want to be a bit more careful with your diet the day afterwards. But you probably won't need to change the dose of your insulin, because after a few hours or a day or so, your sugars will have settled back down to normal. If you find, though, that there's a time of the year where for several days in a row you're eating very differently, then watch your sugars, because you might want to make a change in your insulin to account for the different diet you're having. So, for example, if you're having several days where you're eating larger amounts of food, or you're having more sugary food, you may need to increase the dose of the insulin. The opposite is also true, that if you're having periods when you're eating a lot less, or if you're going for longer periods between meals, you may want to reduce the dose of the insulin. However, when you're taking insulin, you should be quite careful about having much smaller amounts of food, or about having longer periods between meals, because that might make it more likely for you to have hypos where your sugar goes too low. In particular, if you have periods of the year where you fast for long times during the day, we recommend that you discuss this first with your nurse or your doctor, because you might need to make several changes to your diet and to your diabetes treatment. So normally, the everyday changes in the kind of food that you eat and the amount you eat aren't going to be a problem for your insulin, and usually you're not going to need to make changes in your dose according to those day-to-day food changes. But if you're having more prolonged changes in your diet, you may need to change your insulin. If you're going to be fasting for a period of time, we recommend that you discuss this first with your nurse or your doctor. This takes us on to section 3, changes in your physical activity and how it affects your insulin. You've probably already noticed that when you are more active during a day, your sugars can be lower. And the simple reason for that is that physical activity burns off calories, and therefore it lowers the sugar. The opposite is also true, that if you have a day when you're less active, your sugar might be higher, and that's because you're burning off fewer calories, and therefore you're not using up the sugar so much. One of the features of once-a-day insulin treatment is that it's actually quite difficult to make rapid changes from one day to the next in the amount of insulin you have. As we said earlier, we recommend that you look over a 3, a 4 or a 5 day period to decide whether you need to make a change in the dose of your insulin. And for that reason, we recommend that you don't have very big changes from one day to the next in the amount of activity you have. It's actually healthier for people who have diabetes to get some regular activity every day. The type of activity you get will obviously be very different. We recommend you speak to us about what would suit you the best. But even if you're not able to do very much activity, some physical activity is a good idea every day, and to get roughly the same amount will make it simpler to manage your insulin. That's not to say, though, that there will never be situations where you change your insulin dose because of your physical activity. For example, if you know that you're going to be changing the level of activity for several days at a time, then you might want to make a change in the dose of the insulin. For example, if you know that for a period of several days in a row you're going to be a lot more active than you usually are, you might want to make a small reduction in the dose of your insulin. We usually make changes of 2 units or 4 units, so perhaps you want to try having 2 or 4 units less than you normally do. Do keep checking your sugar though, and in particular check it during the time when you're being active, because you want to make sure that it doesn't go too low and it isn't too high. Similarly, if you know that for several days in a row you can't avoid being less active than usual, be aware that your sugar may go up and therefore you might need more insulin. Test your sugars more often, but you might want to decide to increase the insulin by 2 units or 4 units, and then to check the sugars again the next day and see how they go and keep an eye on it that way. But remember to take your insulin back to your normal dose when you come back to your normal level of activity. So to summarise, just like with quick changes in your diet, you normally don't need to make any adjustments of the insulin because of quick changes in your physical activity. These short-lived changes in your level of activity aren't usually a problem for the insulin. Bear in mind though that if you're increasing the level of activity, you're going to lower your sugar, and it is possible that you could lower it too much and you could have a hypo. So don't forget, if you're going to be out and about or away from home, to take your sugar testing machine with you, just in case during a period of activity you might need to have a bit of extra sugar to avoid having a hypo. The fourth common situation where you might want to adjust your insulin is when you're unwell, and we call these the sick day rules, what you should do if you're sick. When you're taking insulin, a very important thing to remember is that you should always continue taking the insulin, and that applies even if you're unwell. So for example, if you have a stomach upset, or your chest infection, or flu, or one of those types of illnesses, even if you're not able to eat normally, you should continue taking your insulin. If you stopped your insulin during a period of illness, your sugars would go much higher, and it might be very hard for the body to fight off your infection. You would also probably feel very unwell just from the sugar being high. So the first part of the sick day rules is that when you're sick, don't stop your insulin, even if you're not able to eat normally. The second rule is that when you're sick, you should check your sugar more often than usual. So most people with twice-a-day insulin, when they're settled and they're well, you just need to check your sugar 2 or 3 times a day. However, when you're unwell, particularly if you have a fever, you'll be needing to check your sugar much more often. And the reason is that your sugar might be a lot higher than usual. Occasionally, the opposite might happen, and it might be a little lower than usual. So you're going to need to be checking your sugar perhaps every 2 or 3 hours during the day. If you're unwell at night and you're awake, we'd also recommend checking it during the night as well, to make sure that you're getting as good control as possible during the day and the night when you're unwell. The third rule is that if your sugar is very high during a period of sickness, you should increase the dose of insulin that you have. It's quite common for this to happen, again particularly if you have a fever. Now because you're checking your sugar more often during the period of sickness, you'll know whether your sugar is acceptable or whether it's too high. So let's give an example. Let's say that my usual insulin dose is 28 units in the morning and 20 units in the evening. But I fall sick and let's say I've got a chest infection. I'm testing my sugar much more often. I'm testing it every 2 hours during the day and a couple of times during the night while I'm up coughing. And what I find is that very soon after becoming ill, my sugars have gone up very high. They were well controlled before, but now, during this period of sickness, my sugars are at least 14 or 15, and they're staying that way all through the day and through the night. So the first thing is, even though I'm not eating normally, I know that I need to continue taking my insulin. But I also know that I should be having a higher dose of the insulin because I'll be feeling unwell with this very high sugar, and it makes it harder for the body to fight off the infection. So normally I have 28 units in the morning and 20 in the evening. I'm going to need to make quite a big increase in the insulin dose to make a difference. The usual adjustment of just 2 units is not going to be enough in this situation. So let's say that in the morning I decide to increase the dose from 28 units to 34 or 36. And in the evening I choose to increase it from 20 units to 28. So what I've done is I've added not quite half again. I've taken my usual insulin dose and I've increased it by not quite 50%, perhaps more like a third in the morning and a third extra in the evening. So that's just an example for me. Your insulin dose might normally be a lot less than that or might be more than that, in which case you should make a smaller or a bigger increase in the dose. So let's take a different example. Let's say that perhaps you normally have 40 units in the morning and 34 in the evening. Well, during a period of sickness, you might want to increase the morning dose from 40 to 50 or 52. And you might want to increase the evening dose from 34 to 42 or 44. So having made that first increase in the insulin dose, I'm going to need to continue checking my sugar quite frequently during the day, the evening and possibly at night as well, and to see what happens to my sugar. It should start coming down, and it should come down quite a lot. It's often hard during a period of sickness to get the sugar really well controlled. So we say, let yourself be a bit more relaxed than the usual aiming of 4 to 7 with the sugar. Perhaps you want to have it just below 10 and accept that. It would obviously be ideal if you could get it a little bit lower, but often you find that you might feel more weak or you might start having hypos if you're too aggressive with increasing the insulin dose. But you're going to find out what's happening to the sugar, because you're going to be doing those tests a lot more often than usual, perhaps every 2 or 3 hours during the day. If you find that after that first increase in the dose of insulin, your sugars are still above 10, then why not make another increase in the dose of the insulin? Because you're trying to get the balance right. You don't want to go too low so that you have a hypo, but also it's much harder to feel well again if your sugars are staying above 10. As you begin to... So that's what we call the sick day rules. The most important is the first one, and that is that when you're unwell, you should always take your insulin, even if you're not eating properly. The second rule is that you should check your sugars more frequently, perhaps every 2 hours or every 3 hours, because your sugar might be a lot higher than usual, but it might also go too low and you might have hypos. And the third is that you need to think about whether you should make a change in the insulin dose. If you're having hypos, you should have less insulin, but if your sugar goes much higher than usual, and especially if it goes over 10 and stays over 10, then you should think about increasing the dose of the insulin just for the duration of the sickness. As ever, if you're unwell and you're not sure what to do, then speak to your nurse or your doctor. If you're unwell and you've increased the dose of your insulin but it's still not helping your sugar, then it's worth getting urgent medical help. And you'll know from your nurse or your doctor who to call when you need that. To finish off with, I'm going to talk about 2 special situations where you may need to adjust the dose of your insulin. The first is if you travel to a climate which is very much hotter or very much colder than the one you're used to. And the second is what to do if you have periods of the year where you want to fast from food. So firstly, what happens when you travel? Well, usually most of us from the UK, if we're going on holiday somewhere, we travel to somewhere that's a lot hotter than the UK. This does actually have an impact on your insulin, and there are two reasons. The first, as you know, is that you need to be careful about storing your insulin so that it doesn't get too hot. So you'll need to plan ahead and make sure that you've made good plans and arrangements for storing the insulin, keeping it cool. The second is that when you move to a hotter climate, you may well need less insulin than at home. You can often find that in the first few days of being in a hotter country, you can see your sugars dropping really quite low. You might even get hypos soon after you arrive in a hotter country. So what should you do? Well, the first and most important thing is that when you arrive in a hot country, for the first few days, make sure that you're checking your sugar more often. And that's going to tell you what your sugar is doing. You might not have had a hypo, but you might find with testing your sugar that it is getting too low. If that's the case, then you should adjust the dose of the insulin downwards, so you should have less insulin. Perhaps take off 4 units or 6 units, just to account for the hotter weather. And then again over the next day or two, you're going to want to check your sugar more often to see if that change in your insulin is enough. And you'll be able to decide, as you settle into the climate, what the right dose is. You can continue making those changes of 2 units or 4 units, or if you need to make a bigger change, 6 or 8 units each time. And most people will find that within a few days or a week, they've been able to adjust the insulin quite well to suit their different needs. But it does mean you do need to prepare a bit ahead. When you're out and about, you'll probably want to take your sugar testing machine with you. And you'll also want to have some sugary things to eat available, just in case you go too low with the sugar in the hotter weather. And then when you come back to the UK, bear in mind that now in the colder climate, you'll need more insulin than you had in the hotter place. And so you'll probably want to go back to your previous normal insulin dose. If you're unsure about how to make these changes, do speak to your nurse or doctor before you travel. It's always better to be prepared than find yourself in difficulties once you're on holiday. It's also a good idea to think before you travel about what you would do if you needed medical help while you were away from the UK. It's very important to have health insurance before you travel and to tell your insurance company that you have diabetes and that you use insulin. Also, it's good to know about the country you're going to and how you would get help if you needed it while you were there. Secondly, I'm going to talk briefly about fasting. Some people, for religious reasons, wish to fast from food and some drinks during the day at some periods of the year. Before you do this, it's very important to speak to your nurse or your doctor about your diabetes and the treatment for it. This is a situation where it's very helpful to have specific advice for you about how best to adjust your treatment. And I'm not going to go into details here about how to do that. However, there are 2 general principles to bear in mind. The first is that all of the major religions say that people who have medical conditions such as diabetes are not required by the religion to fast. If you're unsure about this, do speak to leaders in your faith. They'll be able to give you the full information about this. But it's important to know that you are not obliged by any of the world's major religions to fast when you have medical conditions such as diabetes. And that's because it's quite difficult to look after your diabetes well and still to fast. Good diabetes care requires you eating regular mealtimes in a predictable way. The second thing to know is that if you do choose to fast, you're going to need to be careful about what you eat, how you are during the middle of the day, and what you do with your treatment. And in general, you're going to need to be careful not to overeat when you break your fast, not to have too many highly sugary things or highly fatty foods when you break your fast. You're going to need to be careful during the middle of the day because your sugar might go very low. You could have a hypo. And lastly, you're probably going to need to reduce your insulin and possibly your tablets as well. And particularly for people who have insulin once a day, you might actually be best changing to a different type of insulin if you really do want to go ahead and fast. So beforehand, don't wait until the period of fasting has started. Before it starts, make an appointment with your nurse or your doctor just to discuss this with them and plan what you're going to do. And that way you can ensure that your sugar doesn't go too high and also that it doesn't go too low. Well, that's the end of this information about how to adjust your insulin dose yourself. As I said at the beginning, it's our goal that every person who takes insulin is confident to adjust the dose themselves, to make those decisions about how much insulin they need. It's relatively straightforward. I hope you will agree, having heard the recordings, that it's fairly easy in most situations to decide whether you're taking enough insulin or whether you need more or you need less. Most people find that in those first few weeks of using insulin, they quite quickly get a feeling for how best to make those changes to the dose of their insulin, and that within a short time you're able to get much better control of your sugar than you've ever had with tablets. Don't forget that if you ever have a question or a concern or a problem regarding your insulin, do speak to your nurse or your doctor. Make sure that you know exactly what to do if you're having a hypo or if your sugars go too high, and know how to get help if you need it. I hope that this recording has been useful to you. I hope you now feel confident to look after your own insulin and look after your own diabetes much better. Good luck with it.